My name is Rebecca, and I'm super honored to have the opportunity to speak with you guys today. I'm a registered nurse with the BC Cancer Agency in the Hereditary Cancer Program High-Risk Clinic. I currently serve as a nurse navigator, which is something that you may have heard of before. It's a relatively new role to Canada, but I also could be called a care coordinator for this program. I have 4 years of experience in oncology nursing, and I'm certified in oncology nursing with the Canadian Nurses Association. I'm originally from all the way across in the Maritimes in Nova Scotia, but I've lived in a few places in Canada, and I've been calling BC home for the past 3 years, and I've been working for BC Cancer Agency in a few different places until I took this role. I've been in clinic, I've been in chemotherapy or in a treatment room, if my name is familiar. And now I'm here with the Hereditary Cancer Program with our lovely team. In addition to some clinical roles, I have some background in nursing research with the University of Regina, and I have some public outreach experience with the Canadian Cancer Society. And my professional interests mostly lie in preventative care, some research and knowledge translation from all those papers to you guys. So I'm really excited to be here and hopefully share a few tips and tricks for navigating the healthcare system and giving patients the power to navigate their own journey along what can be a little bit of a challenging ride occasionally. This might be a very beginner overview, but I'm open to talking about it more, and I'm really excited to hear what questions come from this presentation. Okay. So I have no personal disclosures, but my main disclaimer is that I aim to provide guidance and support to individuals navigating our healthcare system concerning risk-reducing measures and screening for BRCA mutation carriers here in BC. And while my role has some experience and knowledge in certain aspects of healthcare, I'm not an expert in every facet of the healthcare system. So my objective is to work alongside patients, serving as kind of that connection between the patient and the multitude of services available here in BC. And so hopefully that nursing experience can kind of help bridge some of the gaps that might occur when we don't know where to turn. I can't guarantee a flawless experience in our healthcare system based on this presentation, or even connecting with me personally if you ever choose to in the future. I'm also navigating with you, and it's a super dynamic, constantly changing program here in BC. So I'm committed to initiating some conversations and identifying those gaps. That's really what we're looking for today. So thank you for entrusting me with that, and let's see if we can gain something from this. So for today, we'll be covering just a brief overview of the healthcare system in BC. We'll go over what on earth I'm doing as a nurse navigator, your roadmap for care if you've been identified to have a BRCA mutation here in the province, about the high-risk clinic and what that service offers for you guys, what to do if you don't have a family doctor, which is an all too common concern across Canada, how to prepare for conversations with your healthcare providers, why on earth are we waiting for certain services and what is influencing that wait time, some tools to bring to your family provider if you can secure one, what other services exist, how we can approach care in a team-based manner with all of the things that we can reach out to, and then some extra tips and a bit of a question period at the end. Okay, so firstly, the healthcare system in BC, I mean, we all, I assume, are currently living in BC, being in this group today. But for anyone new to the province, I just wanted to give a brief overview of how to get started, or if you have family members from other provinces who are looking to move here, who might need some assistance. The main backbone of healthcare funding here in BC is the Medical Services Plan. And so you will have to apply for that as soon as you arrive. And once you're permanently established, you'll need an address for it. But it covers most medically necessary care for citizens of BC, landed immigrants, and government-assisted refugees. So medically necessary means that you have screening that is covered for high-risk individuals like those who have hereditary breast and ovarian cancer syndrome, such as BRCA1 and 2. It would cover surgeries that are deemed medically necessary by a doctor. It would cover most other services and appointments with a specialist. And so for the most part, it will encompass what we have to offer here in our clinic. It's important to note, though, that healthcare delivery and funding might vary across provinces. So if you have family in Ontario who are covered by a high-risk clinic or are being followed by a provider for a hereditary predisposition to cancer, their journey might look a little bit different from what our journey is offering. And even what eligibility criteria might include to be offered a referral to our program might be a little bit different as well. And as we transition into new phases post-pandemic, there's a big opportunity to reassess and adapt our existing processes. There's a lot of lost ground and restructuring to have happen, to be resilient to future disruptions in healthcare. And I mean, as we all have probably seen and experienced up to this point, there were a lot of delays in care after the pandemic had occurred. Until we are back on track, hopefully we can fully get back on track. It is a big responsibility for patients to pilot their own ships in terms of the care that they are seeking. And so having those tools to make sure that you're not falling between any cracks is very important. For a little bit of context, in 2020, at the very beginning of that pandemic, we had a 68% decrease in breast cancer screening imaging from March to December of that year. This was reported by the Canadian Cancer Society, and we are still recovering because resuming services isn't enough when you have a big enough decrease like that. So we're catching up, and we have a shortage of staff and a shortage of clerks and a shortage of nurses. And so it's a challenging time, but we have to work with what we have and take that active role in our care journey amidst these challenges. Next up, what is a nurse navigator? This answer might be different for every nurse navigator you ask, but we primarily focus on the clinical aspects of a patient's care in their respective healthcare facility. So my goal is to help you navigate your way to quality and timely care while explaining and responding those treatment-relating and screening questions. So I have that little bit of background knowledge above and beyond just making sure you connect with the right services to answer questions about your care or treatment, or help you make those decisions on what is next for you. We have that extra training beyond like a program coordinator in terms of healthcare and values assessment. So even in the absence of a formal navigator, we also aim to make sure a program is set up to empower you with the necessary tools to effectively communicate with your healthcare system that you're in. So having us available, hopefully even without us holding an individual hand, we can make sure that a program is accessible for you. In this very, very tiny text, what you see on this slide is a simplified roadmap for care for a hereditary high-risk patient in British Columbia. As participants in this session, I can probably assume that either you or someone you know has followed a pathway like this in discovering that they carry a pathogenic BRCA variant. So you might already be in our high-risk clinic. You might be a patient of ours. You might have been seen by the Hereditary Cancer Program already, based on a couple of different pathways that have gotten you there. Or perhaps you're a family member who's watched someone go through hereditary cancer testing, genetic testing. And there are a few different avenues that you can take from that genetic testing point to being followed by a professional that would be best fit to you. And that could be us. That could be out in the community by your family physician, or if your test was negative, of course, there would be no further action required. One important thing to note is that within the Hereditary Cancer Program and reduced cost of genetic technologies and new guidance on collecting family history, we have better detection of hereditary syndromes, which has a great opportunity for reducing cancer risk, but it also increases the wait times for our services for genetic counseling, risk management clinics like ours, and those specialty services that we might send you on to, like breast surgery, screening imaging, or gynecology services. At the moment, for example, in 2016, we were seeing 300 patients in the high-risk clinic. Today, the most recent count is 2,000. And huge demands on the Hereditary Cancer Program as a whole for genetic testing means that we are facing a 2-year wait list for that initial testing. And that is great to see the rapid growth and utilization of genetic cancer services, but until we increase our teams to meet that demand, it does mean that there's a bit of a challenge, a bit of a funneling in our program. Once we get to the point of being in the high-risk clinic, if you're waiting to be seen by us, this is what we offer. If you're already being seen by us, this is how we typically work. And I just wanted to review that. If you're being referred to us or if you're seeing us, our role in our program is to develop a personalized care plan based on your risk scores. We aim to manage preventative medical care and surgeries. We hope to ensure access to cancer screening that applies to you, such as diagnostic screening like MRIs or mammograms, various scans, and we act as a central hub for your needs. So we are one large pillar in the main web of your healthcare team, which includes your family doctor and includes the specialists that we might refer you to. We hope to continue to grow our scope in what we manage as our patient needs continue to evolve and we learn more about what risk reduction can be offered to BRCA carriers. At the moment, this is what we have, and we work with primary care providers like a nurse practitioner or your family doctor to ensure well-rounded care outside of this current scope that we're offering. Based on your genetic test results and your eligibility for this program, you would be followed by us from the ages, typically from about 25 years old or the time of testing until 70 years old, when your screening needs may change, or until you reduce your risk for cancer by various risk reduction offerings that we have, such as surgery or chemoprevention, etc. Or if your needs change and we find a cancer that you're actively treating, there would be a bit of a shift in your team to better fit your needs. Let's see here, apologies. And while this all sounds great, one question that might come up for those of you in our presentation today who are waiting to be seen by us, what on earth do we do when we're waiting to be seen by the high-risk clinic? For a long time, our wait lists were 6 months to be seen by our providers. And that is so nicely improving at the moment, but it is a dynamic thing based on demand. So if you're waiting to be seen and you've been referred to the high-risk clinic, one tip for you that I have today would be to be utilizing the genetic counselor's note. You would have gotten a consult note from them when you had your genetic testing, and they would have recommendations for screening that you can take to your family doctor or your nurse practitioner to get the ball rolling in terms of risk management, such as ordering that first MRI or first mammogram, and make sure that they have an active role in knowing what your care needs are. It also opens up the door for that conversation to what's developed in terms of your needs and screening, and then also opens that communication between the high-risk clinic and the family provider. So that's a great first step if you're waiting to be seen by us. We currently face a few challenges that are important to be aware of as patients, including navigating different pockets of the healthcare system in terms of accessing records. So for example, we have a screening mammography program here in BC where we have access to mammogram reports when we order them or refer you into the program. But some private like private clinics that are funded by MSP for mammograms don't send reports directly to us. So even if you're followed by us, it's important to make sure that you're aware of where things are being sent and asking those questions about who is getting my imaging reports so that we can adequately follow you. We try our very best to make sure we're proactive in seeing results in a timely manner, but occasionally in healthcare, things do struggle to even go 15 feet with fax machines and some old technologies. So it's important to be accessing those, knowing where to access those yourself as well. All right. So using the Hereditary Cancer Program and the high-risk clinic as a resource for your family provider is very, very important. And like I said in the previous slide, it's good to start that conversation with your family provider, even if you're being followed by us, so that they know that you have some increased needs for risk management based on your genetic test results. You might be wondering, why do I even still need to see my family provider if you're managing all of this screening for us? But we believe that the primary care practitioners and nurse practitioners serve as that central hub for general health concerns and as custodians for our health history. They're expected to know a lot about many things, and being a generalist in that way can be very challenging. So they deserve a bit of grace if they don't entirely know the ins and outs of hereditary cancer syndromes. It's important to look at that provider and patient relationship as a collaborative one with the same goal destination, kind of like driving a car together. It's important to be at least in the passenger seat of that car for your care and not necessarily in the back seat, hoping that you'll get where you need to go, because your provider might need a little bit of guidance to help you along on your journey. And that will include making sure that communication between all of those specialty services is clear. And so bringing reports and consult letters and information from our website to them with recommendations is very important, and they can use their tools and education and wealth of knowledge to make sure you can access those things. I think one key thing is that I try to remind my patients is that you are the expert in your own health, as you're the only one who lives your experience day in and day out. We have the education and the tools to help you achieve what you're looking for as best we can, but not especially your family provider. They don't have that same knowledge to your values and your beliefs, and without active participation and engagement in those appointments with them, they won't necessarily know exactly where you might want to go. But unfortunately, in BC, it can be very challenging to get a family provider. So all of this sounds great. It'd be wonderful to have a team available to us to guide our care. But unfortunately, it is an all too common situation to feel like you're totally on your own here in BC. There are a few options to making sure that you're covered if you don't have a family provider at this time, and I wanted to review those today. One would be walk-in and urgent care clinics. And I say that and I wonder if in the background there's a bit of a groan because occasionally they can be hard to get into. But there are a few points that I wanted to make about walk-in and urgent care clinics that might make things a little bit easier. In 2023, there was some legislation that had passed that mandates that patients who attend the same walk-in clinic without a primary care provider must be considered as receiving primary care from that clinic. This enables continuity of care and records that can be maintained over time. So even if you're not seeing the same provider in a walk-in clinic, if you continue going to that one with your needs, then they do have to maintain longitudinal records. So records every time that you see them so that they can refer back to. If you reside pretty far from a high-risk service such as ours, if you're living up in northern BC, walk-in clinics can serve as sites for those annual clinical breast exams that we recommend. They can be a site for you to ask for a local referral to a specialty service such as a gynecologist, and they can initiate those initial assessments for new concerns. So if you were to find a new breast concern and weren't sure what to do with that, then the primary provider would be the most acceptable person to reach out to work up that concern, and then we would be looped in as the specialty clinic. Unfortunately, being only in Vancouver and being a specialty service, we just don't have the same appointment availability for those urgent concerns, but we do work with your primary care providers or these walk-in clinics to make sure that you get the care you need. Let's see here. Apologies, just taking a quick look and regrouping for these notes. For finding a primary care clinic, it's important to familiarize yourself with what's in your area. You can ask them about their wait time policies, their booking systems in advance, and maybe even if they have a wait list for their permanent doctors. So you could ask them if I keep coming, can I put my name on a list within your clinic to be accepted by a doctor if they have any space for me permanently. There's also options to be booking these appointments online. Can you call to put yourself on a list so that you're not waiting in the clinic all day? Do they have a policy for having you as a regular walk-in patient? Do they have that wait list like I had mentioned? Can they take on family members? If you have a family member who sees one of their providers, maybe they can ask if they'll take you on as well. A lot of doctors are happy to take on an entire family. And if we have trouble with getting an in-person appointment, or if all of these options aren't working for you, there's also a program called TELUS My Health in BC. It's a free program online that can facilitate access to healthcare professionals through an e-service like Zoom or video call such as this one. They can connect with you virtually, access your consultation notes, they can send prescriptions if you require it, and they can give medical advice from home. And then medical records can be sent directly to you for safekeeping so that you can distribute them to your next specialty appointment with us or another provider. That can be accessed online, and all you would have to do is enter your health card number. 811 is also a service that is a great option for if we're not sure if we need a doctor or a nurse first. I use that service all the time, even as a nurse myself. And by calling them, you speak to a registered nurse, and they will triage your concern and allow you to best choose where to go next, if at all. Sometimes they can solve your question within that phone call. You don't even have to head over to an urgent care clinic. But occasionally, if they listen to what's going on, they might advise you to go see a physician. They might connect you with a physician through 811. Some of them have. There are sometimes physicians available to talk to you on the phone, or they might recommend you head into ER, and that's usually for those more urgent concerns. And if we don't have personal connections or clinics to ask to be put on a wait list for a healthcare provider, such as a nurse practitioner or a family doctor, there's a website that I hope we're all aware of already, but if not, it's called HealthLink BC, and it's our Health Connect registry. This is an online database where we can place our name on a wait list to obtain a family doctor. You can register yourself, you can register family members. If it's challenging to do this online, you can also call 811 and the nurse can register you on your behalf. And if you've already been put on a wait list at your local clinic, they've put you into this program already. So there's no need to do it online. But it's very easy. It takes 5-10 minutes. And it's very important the one thing that I'll say is that it's very important to keep your contact information updated if you do register for this wait list, because sometimes it's a bit of a wait. Maybe we move, maybe our phone numbers change, and they'll be calling you if they find a clinic in your area and matching you with a family provider. So we want to make sure that we're not missing those phone calls. All right, so once we're in to see our family doctor, to see our high-risk clinic specialist, to see our nurse practitioner. How can we get the most out of that appointment? How can we make sure that we are getting our concerns answered, getting our questions answered? And that can be quite challenging when these appointments are stressful and there's a lot of information presented occasionally, especially at our first appointments. Good communication skills are essential for getting that best possible care, especially in a healthcare system where access to primary care practitioners can be challenging. Appointments might be delayed. So planning ahead and making sure you use that time as best you can is so, so important. I recommend having a notebook or an agenda and writing down what you need to discuss with your healthcare team. If you're unsure what's most important, you can give us that list and we can help you prioritize your questions and concerns. If you're able to, in the appointment, bring a notebook, write down important points during that conversation, or sit down afterwards and write them down before you head home. Prioritize what you'd like to discuss and ensure that you understand any instructions. If you don't, before you leave that room, we can get those questions answered, or asking before the end of the appointment, who can I call if questions come up when I get home? It's also important to consider bringing a companion with you, someone you trust, who might have a perspective on your care that is a bit more neutral or less emotionally charged, I'd say, because it can be really easy to feel overwhelmed in an appointment where we're talking about your health and your personal experience. It's a very emotionally charged, values charged conversation in managing our cancer risk. So bringing someone who can advocate for you, who knows you well, is very, very helpful, as making these decisions and sorting out your own care can be a full-time job. For those big appointments with complex information, such as consults with us, they can ask those questions. They can help you manage your time. And there's no shame in asking for help in getting this information. I can understand and empathize with going into big appointments and thinking, I should be able to do this myself. This is my health. But there is no shame, and you should never feel like you're a burden to those people that you trust when considering asking for a companion at medical appointments. It's not a sign of weakness. It's a proactive step towards optimizing your healthcare experience. The next thing that would be really, really important, it would be keeping a calendar of your appointments. For example, in the high-risk clinic, we might tell you that you have your next appointment in a year and a half. And you go, okay, great. But then a year and a half passes and you have an unknown caller on your phone and you go, who is this? And you hit decline. But it's maybe Dr. Kavitz calling you. And that was your annual visit, and we have to reschedule, and that could be quite challenging. So making sure that you have it in your phone, on paper, whatever works for you for planning ahead that far in advance. And then ensuring that your voicemail inbox is nice and empty and available, and you're listening to those voicemails for when we call you with those appointment reminders. You're checking your email if we've told you that we'll be emailing you those reminders, and just being available for those appointments. If we've done all of these tips and tried all of these methods for getting through an appointment in the best way possible, and we're still feeling maybe a bit frustrated with the amount of care or the level of care that we're getting, or the lack of access to care that we're getting, what do we do? How do we handle that frustration? I think it's very, very important to remember that honey will always work better than vinegar when talking to our providers, to our clerks, to our booking agents. Try to approach any interaction with the healthcare provider as positively as you can, even if you're frustrated. Write down what you'd like to achieve in the appointment if you're too upset to talk. We're doing the very best that we can to access this care for you, and ensuring that we remember that we're all humans working together to take care of other humans is a very a key point. Bringing that calm companion, using positive self-talk, and visualizing where you want your appointment to go and what you'd like to achieve can be quite helpful. Being very present in that conversation with your provider. There's a lot of information to get through, and sometimes we just keep thinking about the next question that we have, but perhaps the conversation is already going in the direction where your question will be answered. So it's important to make sure that you're both listening and thinking about what what could be said or asked next. And then it's also important to remember that our doctors and our nurse practitioners are unfortunately quite busy. So assigning emotion to the way that a doctor replied to you or your question, it's never a harmful thing to ask what was intended by a question or by what was said, because doctors are often so busy and they think very logically about risk management. Their reactions might not be personal, so it's never a shameful to ask for clarification on things. If you have to call a physician or if you have to call a doctor's office, my top tips would be to plan out that call in advance. Make sure that when you phone us, you leave all the information possible for us to find you easily in our system to make sure that we can answer your question as accurately as possible. So that would mean having your care card out, your phone number available, leaving your full name very slowly, maybe even spelling it out in your voicemail, and leaving clear instructions for calling back. So for example, if I'm calling with a specific question, I might end the voicemail saying, I will assume that my referral has been received if I do not hear back from you. If it has not been received, please call me back. And that gives whoever's listening to your voicemail exactly what you want. So I like to say that if I'm calling an office, I will say, I'm looking for the report for XYZ. I will assume that you've received my voicemail and will send it to me if I don't hear back, but I will call back in 2 weeks if I haven't received anything. I'll leave my plan and then I'll write down exactly what I did, who I called, what number I used, and what I said, so that I can write myself a reminder to get in touch again later. Because sometimes things don't make it 15 feet in the medical world. I mean, we still use fax machines occasionally, so that can be challenging. It's important to follow up kindly. There's a lot of moving parts in healthcare, and especially if changes occur in your health, it's important to keep us in the loop as you're following up regularly, waiting for imaging reports, etc. So what impacts our wait times? Why are we waiting? This all depends on what we're waiting for. So the initial appointment with the genetic counselor, I've kind of already reviewed that it's usually due to wait times. We triage all of our referrals in for genetic counseling based on urgency, and there are many things that influence that urgency. So therefore, you might find out that someone you know had a 3-month wait, but you've had a 2-year wait, and there are some dynamic patient wait lists that we work through to triage our referrals. You might be waiting for the initial appointment with us, and we've also been really working hard to triage our referrals based on urgency if they impact your care right now. If some recommendations are very timely, such as ovary and tube removal at the age of 40 and you're 39, for example. If you're waiting for imaging, it depends on what kind and where we've sent you. Specialty referrals, such as surgeons, such as gynecologists. There are a few things that affect that I'll talk about. And then our follow-up appointments. Are we waiting for that annual visit? Did you not find out about it? That's an easy one. We can definitely be calling our clinic to make sure that it has been booked prior. So it's important to ensure that we're aware of that. Usually those are booked pretty quickly after the last visit. Let's see here. So we'll get started on, for example, surgery referrals. It's important to understand that wait lists are how physicians and hospitals will track and schedule individuals in need of specialized medical care, organized by that urgency. And our wait times are sorted by a wait 1, which is a time to first specialist consult, and a wait 2, which is the time from booking the procedure to completion. There's no single wait list for all surgical procedures in British Columbia, unfortunately. Depending on the type of surgery required, we might be placed on a provincial wait list, a regional wait list, a hospital wait list, or one surgeon's wait list. So for example, those popular plastic surgeons with both private and provincially funded practices have a very long wait list. Emergency surgeries are prioritized and usually treated without delay, and that would be for like a new cancer case. And then those pooled and smaller community surgeon referrals might have slightly shorter waiting times that I like to highlight. Your type of plastic surgery that you choose or decide upon with your team might also impact your wait time based on availability of that surgeon and how much time the type of reconstruction that you choose will take. One of my tips for if you're looking to have a breast surgery as soon as possible, it's a big priority for you to reduce your risk, would be to maybe consider a smaller community provider. If you live outside of Vancouver, or requesting a smaller community provider outside of Vancouver, because they sometimes see shorter wait lists for things like these surgeries due to less population demand. However, it's important to note that if you have other health factors or preferences to consider that might complicate your care in getting a surgery at a smaller center, it might not be your best fit. So consider what best care looks like for you, whether you're willing to wait, or if your biggest concern is getting that service as soon as possible. Another tip for making sure that you have access to these services as soon as possible would be to consider maybe asking to be put on a cancellation list. This can offer opportunities for earlier appointments and surgeries, but it's also important to consider the pros and cons of this. This might mean that you get very short notice for a surgical date, and planning for time off, arranging support at home, childcare, those are all factors to consider, and waiting for 2 years for a surgery date and then being notified that you have 1 week to prepare can be very stressful. So when considering whether or not you're willing to be on a cancellation list, it's important to think about those factors at home. And as you navigate the wait times for these services, it's important to advocate for your needs and stay informed about the process. So active involvement can help ensure timely access to these healthcare services. This might mean regularly checking in on your wait times, making adjustments to your personal factors to allow yourself to be placed on those cancellation lists, asking your providers to check in on where you're at, and don't be afraid to do this. It can be so frustrating to wait for years for a service such as a surgery, and making sure that I call it being a squeaky wheel, making sure that our providers are aware of you and aware that you're still waiting and aware that you're still interested will put you front of mind and ensure that we don't forget about you in the booking process. If you ever have a health-related change while on a wait list for any service, so MRI, mammogram, surgical referral, gynae referral, whatever we've sent you for, please update us, whether that's contacting the high-risk clinic, whether that's contacting the family doctor who ordered your test. Sometimes a change in your health, such as a breast change especially, will change your position on the wait list or even change what test we're looking for. For example, screening mammograms aren't done if you have an active breast concern. We would change our mammogram order to be a diagnostic mammogram. So we do have to make sure that we're up to date on how you're feeling and what you're experiencing. This kind of leads me into how our screening imaging system works. And I've decided to focus on our two big ones in the high-risk clinic for our BRCA carriers. And that includes the screening mammography program and MRI screening. The screening mammography program is run independently of the high-risk clinic, but is linked to us. And we refer you into that when you come to us, as long as there are no special circumstances. This would be a purely screening annual mammogram program, and it would be offering you mammography services as close to home as possible, whether it's at a third-party facility, whether it's at your local hospital, maybe it's a mammogram screening truck that comes around to smaller towns, and they send us reports regularly on the mammograms that are done. If there's ever anything abnormal on a mammogram, we often try to get the other type of imaging, such as MRI or ultrasound, to get a clearer picture. And then we put you into a more diagnostic pathway to work up that concern. If we find that it's a concern, then we would take steps as necessary. And then if we find that it is a non-concerning difference in anatomy or finding, then we would put you back into the mammogram screening program once we clear you, give the green light for them to resume that screening service. For MRI screening, our program would order that annually, and it would be, again, as close to home as possible. But the booking services will be at whatever facility we've ordered it to be at. So ensuring that you're regularly calling them with booking updates is very important, because occasionally the wait times can be quite large as well, depending on where we've sent you. And if you're noticing that you're waiting especially long, like it's been months since the MRI has been due for you and your screening schedule, don't hesitate to reach back out to whoever ordered it, whether that is us or your GP, to check in on that process and maybe redirect that referral for the MRI. Who gets my results? It depends on who orders it. We get most results for the mammograms and the MRIs, and it takes typically about a week and a half to get those results and review them. We only call with abnormal results. We don't call out normal results just due to capacity concerns, but you have many tools to find out what happened with that imaging, such as Health Gateway. If you live near Vancouver or Island, eHealth, there's a lot of digital platforms for receiving your records, or calling the facility for a report. It is still definitely in your ballpark to be finding those results, even if we don't call you. But if you've tried all those avenues and you still aren't sure what happened, you're welcome to get in touch with us. Okay. If we've tried all of these tips and tricks that I've offered today, or we've gone through a screening workup and we've hit a roadblock in our care, for example, we've left 5-10 voicemails, we've been calling weekly to book an MRI and we're overdue, or we have our health changing, who do we contact to help us triage where to go next? My best recommendation would be to start with your GP and see if the most local to home, all-encompassing care provider can help you. If it's a more specialized concern related to your high-risk screening, you can reach out to us. You can reach out to the facility again and stress that you're overdue for this imaging. And I am also happy to call and on your behalf and advocate for whatever it is that we're seeking. Because it's okay to not be 100% sure. That's my job in sorting out who to call next. And occasionally triaging your concern can be overwhelming if you're the one living that concern. So let's see. For those urgent concerns, as I said, it is quite important to triage them first. So taking a step back and going, how soon do I need this seen? Is this something that I need seen within 24 hours? Typically, that is an urgent care or maybe an ER type of concern, and calling 811 first to talk to a nurse. She can help you decide whether the pathway should be urgent care or ER. If this is something that can be addressed within the week, possibly your primary care provider can address that, such as a new concern with your breast or a change to your, like, finding a new lump or something like that. They can help you work up that concern and ensure that we're looped in. Is this a question about your screening? Is this a question about your risk management? Those would be things that might not be as urgent, but we'd like review on. You can get in touch with the high-risk clinic or with me. And really thinking about who's on your team, thinking about this as not just one clinic following you, but thinking about who is available to you and who would be best to answer your question, who's the most appropriate to reach with the concern that I have. The next question might be, I haven't been contacted in X amount of time by my provider. What's going on? Have they not been able to reach me? What happens if I don't book my imaging in time, if I've been offered appointments and I keep turning them down, or if life gets in the way and unfortunately I have to take a pause on my screening? Where do I go? Do I get kicked out of the clinic? Are there protocols for reaching me again? What if I change my phone number, etc.? Our clinic, for example, does have a no-reach protocol. For any appointments with us, we attempt to contact you 3 times. And if we don't hear back from you to book an appointment for your annual visit, we put you on a no-reach list. We will send you a mail letter. And then if we don't hear from you within 2 months after receiving that, we do discharge you from our clinic. It doesn't mean that you're permanently removed from the high-risk rating program. You can always reach back out to us to reinitiate that, that follow-up, but we do not continue to try to contact you. Most screening imaging facilities have the same rule. They'll try to get in touch with you 3 times, and then if they can't, they'll stop trying to call, and it's back in your ballpark to book. So if you haven't heard from a booking clerk for an appointment or an imaging appointment, it is important to make sure that you have your contact information up to date and maybe reach out to see if they've tried to get a hold of you first. I also wanted to add a quick slide here on a few more supportive programs that are available to add to your team in case who you have currently isn't meeting your needs. And that includes Inspire Health, as we know here, the wonderful team that supports this support group. They offer counseling services for BRCA carriers. They offer nutrition services. They offer the support group, and you can self-refer, or your provider can refer you to their program, and it's available to anyone with the BRCA genetic mutation. We also have patient and family counseling with BC Cancer Agency for counseling services and financial support, but this is dependent on the situation. Oftentimes, sites only follow you if you've had an active cancer, or if you're a family member to someone who has an active cancer that's being treated. Some services in smaller centers at BC Cancer Agency will take on patients on an as-needed basis if there are no other support options available. But I wanted to still include it as an option to reach out to or ask about if you've tried your other options and they haven't been successful. There's also the Canadian Cancer Society, which is a wonderful resource. They have amazing information specialists if you have general questions about your health and navigating your risk for cancer in general. And you can contact them through the website, and they can call you and help you sort through what information you're looking for. I also wanted to highlight for those who are living outside of the Vancouver area or way up north or in small towns that we have a lot of travel assistance available for getting to us in Vancouver for the high-risk clinic appointments or MRIs that we require for your risk reduction. And that is listed here. If anything is unfamiliar to you, then you're welcome to put it into the chat and we can send a bit more information about it. But there is lots of travel assistance to getting to us in person if you ever need that. I recognize that this has been a long presentation, and so in summary, we're navigating the system with you. There's a lot of complexity to it, and it was very challenging to put together a presentation today on exactly what you guys maybe were hoping to talk about. So if anything wasn't addressed, please feel free to place that into the question list and we'll try to address it. This is just the tip of the iceberg, and I'm also available as a nurse navigator within the program if you're a patient of ours for any questions in the future, or if you'd like to kind of self-refer to me, if you have higher needs or complexities to your personal situation. I have my contact information here by email, and this will be sent out as well, and we can try to sort out your best care. All right. Thank you very much for your time today, you guys. I'm very open to questions, and I also have the rest of the high-risk clinic team here today listening in so that we can have a bit of a panel with the time that we have remaining.